Of all the important things you're going to be hearing today in this video, I want you to note that a bad umbilical stump care can actually give rise to neonatal umbilical. Now, the big question everybody is going to ask is, what is neonatal umbilical? Keep watching.
We keep seeing their eyeballs glued to us on the sidewalk, but that look could kill. They are trying so hard to find all the weaknesses inside, but
Welcome back to my channel, guys. I'm Kenzie and I am a final year nursing student currently based in Nigeria. And in today's video, I'm going to be sharing with you guys the importance of umbilical stump care and the dangers attached to umbilical stump care. I'm deciding to make this video because it has been observed that many mothers, many aunties, many grandmothers, many step aunties, many people actually have lots of misconceptions about umbilical stump, and everybody seems to have their own ideology attached to how they should care for an umbilical stump. And in many cases, I've seen where where an infant actually lost her life because of the care that was given to her by our parents were not actually in line with what the World Health Organization actually wants us to do. So to further broaden our knowledge, I'm going to be taking you guys along this beautiful, interesting topic. So it is not going to be nice for us to just jump right into this topic or subject without actually knowing what is umbilical cord. Umbilical cord is actually what connects the fetus and the mother in utero. So the content of that cord is actually two arteries and two veins. Now these arteries are what actually transport oxygen and nutrients from the maternal circulation to the fetal circulation, and it also returns waste products from the fetal circulation to the maternal circulation, and then the mother actually excretes them. So when a pregnancy is term, like when a woman is due for labor, which is between and 40 weeks, she goes to the hospital, of course, and then upon delivery the baby comes out. The fetus that has now turned to a baby comes out, and when the baby comes out, the baby presents an umbilical cord. Now the doctor or the midwife that is actually carrying this procedure actually clamp the umbilical cord from both ends, that is from both the baby's part and then the mother's part, and then it is cut. Now the umbilical stump that is remaining on the baby is supposed to be about 2 centimeters to 3 centimeters long, so you're not supposed to exceed that rate. Now the care now begins. This is the part where every mother and everybody seems to have their own way of doing it, but according to the World Health Organization, they prescribe that we use topical antiseptic for the care of the umbilical stump. Remember, the umbilical stump is just a very delicate part of the baby's body. If anything goes wrong, the baby can actually lose his or her life. The umbilical cord in utero was where the baby was getting all the oxygen and all the nutrients from. That umbilical stump that you're seeing can actually serve as a very easy way for microorganisms, germs, and whatnot to enter into your baby's blood. That place is directly connected to your baby's blood, so anything you introduce into that place is actually going to go into your baby's blood, and if care is not taken, it can lead to sepsis, and then your baby can actually, God forbid. So the World Health Organization has actually recommend that we use a topical antiseptic, as I said earlier, but then our own Nigerian government has deemed it fit for us to use a methylated spirit. Methylated spirit is advised because it is an antibacterial, and it actually kills all the microorganisms and germs that are supposed to be, wear them clothes, we change their diapers, and microorganisms are just flying everywhere. There are some that you can see with your naked eyes, there are some that are microscopic that you can't even have any access to them. So it is now left for the parents or the caretakers to actually make sure that they use an antiseptic solution which our Nigerian government actually prescribe methylated spirits. They should use it to cleanse the umbilical stump thoroughly without infecting that part. Another thing that you can use for your baby can actually be a chlorhexidine solution or gel. Now, this actually, most hospitals actually give chlorhexidine solutions, chlorhexidine gel, but it is not very common. I mean, methylated spirit is the most common. That is why you see that everywhere you go, they're always prescribing or they're always giving them methylated spirit. But then you see that some people actually use some very some materials are not supposed to be introduced. Once when I was working in a ward, I actually encountered someone that brought back her baby to the clinic, and then few days later the baby actually lost her life. Now she had given birth to the baby fine, the baby was okay, the baby was perfect, only for her to they gave her the normal methylated spirit for her to use. And I'm sure that she had gone back to the house, and maybe her mother-in-law has told her that, why are you using, I forgot to even mention, the normal color for the umbilical cord is supposed to be yellowish, pale yellowish in color. It's supposed to be pale yellowish in color. From pale yellowish, it's supposed to turn to brown, and then from brown, it's supposed to go to black, and then from black, it falls off completely. Now, when it falls off, it is supposed to bleed a bit. So when you are taking care of your baby's umbilical stump, and then you see that after the stump falls off, there is a light bleeding, it is very normal. And the stump is supposed to fall off between 5 to 15 days after the baby is born, after the neonate is born, after the baby is born. So the stump is supposed to fall off from within 5 to 15 days. So if the stump has not fallen off between 5 to 15 days, then you know that something is wrong and you need to go back to your doctor or your midwife. So back to the story, the mother was actually given an antiseptic solution, which is a methylated spirit, for her to use in cleansing the baby's umbilical stump. But when she went home, her grandmother had told her that, not her grandmother, her mother-in-law has told her that, oh, see, all these things that people are using these days, I don't even understand it. Why will you be using this thing? When I gave birth to my son, I did not use it. So please don't even use all these things. They are going to cause harm to the baby. And then the mother gave her a Maclean. I've heard cases where people use Maclean to actually remove the stump. They say if you apply it on that on the stump, it's not even going to take up to maybe a week. It's going to fall off. Whereas if you use a methylated spirit or all these oyibo things that they give people in the hospital, it's going to take long and it's going to be painful to the baby. So that was how this woman actually obeyed her mother-in-law, used the Maclean on the baby's stump, and the baby got infected and the baby actually lost her life. So please don't be like that woman. You don't have to wait till something actually happens. Like, you don't have to wait till something bad happens to you before you learn your lesson. The methylated spirit or the solution that was given to you by your doctor is actually the best thing for you to use. Another thing you can use if you don't have access to, or let me not say if you don't have access to, because the methylated spirit, everybody actually has access to it. If you do not want to, like, another remedy, let me just put it that way, another remedy you could use to remove your umbilical stump is actually the breast milk. Now, the breast milk is, although the breast milk has bacteria, but the breast milk is actually very rich in protein. It contains lots of nutrients that can actually nurture the umbilical stump and enhance fast healing. So if you're thinking of what to use to fall off your baby's stump, please, instead of using the normal Maclean instead of using Maclean or other things, I've heard of Vaseline too. Vaseline is very bad. It is either you're using a chlorhexidine gel, a methylated spirit, or your breast milk. Your breast milk is actually very good. Apart from the normal abdominal stump, apart from the normal umbilical stump, breast milk can actually be used to heal lots of blemishes you have on your skin. If you notice that your baby is having some rashes, if you pour breast milk, like fresh breast milk, please, fresh breast milk, the one you are pressing from the breast immediately, not the one you've refrigerated, not the one you've pumped before. Fresh one, please, fresh one. So if you're using fresh breast milk on any part of your baby that has blemishes, eczema, all those baby stuff, especially when they are still neonates from 0 to 28 days, it is going to work as magic. Breast milk is actually very good. So it is going to actually help your baby heal fast. A bad umbilical stump care can actually give rise to neonatal omphalitis. I'm going to insert a picture of what neonatal omphalitis actually looks like. It is actually a bacterial infection that is caused by bacteria, of course, like Staphylococcus aureus, Staphylococci, E. coli, Epidermides, and all the bacteria in this world that you can think of. So if your baby's umbilical stump starts turning from pale yellowish in color to a very dim yellow, or it starts getting very green, or it starts getting irritated, please consult your doctor or your health practitioner. If you also notice that your baby's umbilical cord is getting reddish or is bleeding more than normal, because your baby's stump is not even supposed to bleed in the first place. So if you notice that there is any abnormalities, please consult your healthcare practitioners. Your baby is not supposed, the stump is not supposed to be to be how do I how do I even put it? The stump is not supposed to be not supposed to be red. It is supposed to be either pale yellow in color, that is if the baby is just coming out from the mother's womb. Pale yellow is the normal color. Now after a few days, it is supposed to now start turning to brown, light brown. Then after a few days again, it's supposed to now be black. That is when it starts being hard and black, and then it eventually falls off, and then that is all. Then your baby will now have the normal navel. So please be sure to take care of your baby's umbilical cord, not cord. Be sure to take care of your baby's umbilical stump. Many children have lost their life as a result of their mothers, their grandmothers, their mother-in-laws, endless wisdom about health. Health is not something that we are supposed to gamble with. Please, especially your baby, your neonates, you should take care. That stage of their life is their most delicate stage. If they exceed the neonate stage, then they are good to go. So please be sure to take care of your children. Is there anything else that I'm supposed to talk about? So I'm going to give it up for grandma. I know grandma has actually been very faithful to what the doctors have actually said. I mean, I saw that video of her, I don't know if it is the doctor or the assistants, one of the persons that assisted in my sister's delivery actually gave her the antiseptic solution for her to use, and I saw her actually using that, which I applaud her for it. I mean, she did very well. Most mothers would, I mean, I don't think she used that for her first child, which is my sister, because every time, every year, every century, things keep changing and new ideas keep coming. In their own time, they did not use any of those. Nobody was talking about methylated spirit because it's even harsh to the baby. But then I applaud her very well, because even as old as she is, she did not allow her ignorance actually take the better part of her. Most mothers will say, this is not the thing I am used to, so I'm not going to use it. But then she used it, so I am very proud of her. And I'm also very proud of all of you too that have given birth to children and have been sticking to the doctor's advice. Most people will not do it, and I don't understand why. Is it that you know more than the people that prescribe this thing for you? Please adhere to all medical advice, especially when you know that they are coming from a trusted and experienced person. And then one thing I also want to add is that it's like we're going to start talking about more health related topics. So if you have any questions, any suggestion, any correction, please, I'm very open for corrections and to your corrections. If you feel I said something I'm not supposed to say, please drop it on your comments on my comment section, because I also want to learn. If you have any topic you want me to talk about, please drop it on the comment section, and I'm going to see you guys in my next video.